Welcome to Podocyte Talk. Today we're discussing three important studies that highlight the connections between kidney function, cardiovascular health, and therapeutic strategies in hepatorenal syndrome. The first study, based on the Generation 100 study, followed over 100 adults aged 70 to 77 years for 5 years to investigate whether exercise could help preserve kidney function. Participants were divided into three groups: a control group that received general physical activity advice, a moderate intensity exercise group, and a high intensity interval training group. After 5 years, those in the high intensity interval training group had the lowest risk of rapid kidney function decline, suggesting that more vigorous exercise may provide greater benefits for kidney health. Additionally, participants who increased their physical activity levels over time also had better kidney function compared to those who remained inactive. These findings reinforce the idea that staying active, especially with higher intensity workouts, can slow kidney decline in older adults. The second study analyzed data from over 50,000 U.S. adults to evaluate how cardiovascular-kidney-metabolic syndrome staging predicts cardiovascular mortality over 15 years. Participants were categorized into stages based on the American Heart Association's guidelines, with stage 0 representing no disease and stage 4 being the most advanced form. The results showed a clear progression in risk, with cardiovascular death rates increasing significantly from 5.5% in the lowest risk group to 15.2% in the most severe stage. Additionally, those in the highest risk category had a life expectancy that was over 5 months shorter than those without the disease over the 15-year period. These findings highlight the importance of early detection and management of metabolic and cardiovascular risk factors to improve long-term survival. The third study explored an important question in the management of hepatorenal syndrome type 1, a severe form of acute kidney injury in patients with cirrhosis. Traditionally, diuretics are avoided in these patients due to concerns that they might worsen kidney function. However, this study investigated whether adding intravenous furosemide to norepinephrine, a vasoconstrictor used to improve blood pressure, could safely enhance diuresis without harming kidney recovery. The study examined 26 patients with hepatorenal syndrome type 1 who received intravenous furosemide alongside norepinephrine. Initially, patients had low urine output and severe kidney dysfunction, with a median serum creatinine of 4.0 mg per deciliter. Treatment with norepinephrine alone increased urine output, but the addition of furosemide further boosted urine output to over 2 liters per day, a response not seen in the control group who did not receive diuretics. Importantly, 73% of patients treated with norepinephrine and furosemide maintained or improved their kidney function, demonstrating that when blood pressure is adequately managed, diuretics can be used safely in hepatorenal syndrome type 1. Join us on Podocyte Talk. Check the episode description for links to these studies and stay tuned for more discussions on cutting-edge research in kidney, liver, and cardiovascular health. Tune in now to stay informed.